Welcome to the Daily Donald, where we bring you the most detailed and unbiased breakdowns of the hottest Trump headlines. Today is January 11th, and we're diving into a headline that's got everyone talking. Donald Trump has chosen Dr. Mehmet Oz to head Medicaid and Medicare. Who is Mehmet Oz? How did he rise to fame, and how did he end up in Trump's inner circle? What can we expect from him as he takes on one of the most critical roles in healthcare policy? Let's break it all down. Before we jump in, don't forget to like, subscribe, and let us know your thoughts in the comments. Let's get started. Dr. Mehmet Oz is a name you've probably heard before. He's best known as the host of the Dr. Oz Show, a popular daytime TV program where he provided health tips, explored wellness trends, and interviewed celebrities. But before he became a household name, Oz built an impressive medical career. Born in Cleveland, Ohio, to Turkish immigrant parents, he graduated from Harvard University and earned his medical degree, an MBA from the University of Pennsylvania. He's a cardiothoracic surgeon who performed groundbreaking procedures and became a professor at Columbia University. However, it wasn't just his skills as a surgeon that propelled him to fame. It was his ability to translate complex medical concepts into digestible advice for the masses. This skill led to his TV career, which started with appearances on the Oprah Winfrey Show before launching his own program in 2009. Dr. Oz's connection to Donald Trump began in 2016 when Trump appeared on the Dr. Oz Show during his first presidential campaign. Trump shared his personal health records with Oz, a move that brought the doctor into the political spotlight. Fast forward to 2022, and Oz made his own foray into politics by running for a U.S. Senate seat in Pennsylvania. With Trump's endorsement, he won the Republican primary, but ultimately lost the general election to Democrat John Fetterman. Despite the loss, Oz remained a staunch Trump ally. His ability to connect with middle America and his media savvy made him an attractive choice for a high-profile role in Trump's administration. So why has Trump tapped Dr. Oz to lead Medicaid and Medicare, two of the most significant healthcare programs in the U.S.? Medicaid provides health coverage for low-income individuals, while Medicare serves those 65 and older and people with disabilities. Combined, these programs serve over 130 million Americans and account for a massive portion of federal spending. Trump has long expressed frustration with rising healthcare costs and inefficiencies in government programs. Oz's appointment signals a push for reform, likely focusing on cost-cutting measures and perhaps incorporating more holistic or preventive care, ideas Oz has championed throughout his career. But Oz's appointment isn't without controversy. Over the years, he's faced criticism for promoting unproven medical treatments and products on his show. The British Medical Journal once analyzed his advice and found that nearly half of it either lacked evidence or contradicted medical research. During his Senate campaign, critics also questioned his ties to Turkey and his dual citizenship, accusing him of having conflicting loyalties. Oz has denied these claims, emphasizing his commitment to America. Supporters, however, argue that Oz's charisma, media experience, and medical background make him uniquely qualified to navigate the complex world of healthcare policy. They also point to his ability to connect with diverse audiences, a skill that could be crucial in reaching underserved communities. So, what should we expect from Dr. Oz in this new role? Based on his public statements and past work, we can anticipate a few key priorities. Cost reduction. Oz has frequently spoken about the need to cut healthcare costs, so expect him to push for efficiency within Medicaid and Medicare. Preventive care. As a wellness advocate, Oz may emphasize preventive measures to reduce long-term healthcare costs. Tech integration. Oz has shown interest in digital health tools, so we could see an expansion of telehealth and AI-driven healthcare solutions. Privatization controversy. Critics worry that Oz's appointment could lead to efforts to privatize parts of Medicaid and Medicare, aligning with Republican calls for market-based reforms. Reactions to Oz's appointment have been mixed. Supporters, including prominent conservatives, argue that his leadership could bring much-needed innovation to the programs. Critics, however, fear that his track record of promoting dubious health products could undermine trust in these vital services. Healthcare advocacy groups are already mobilizing to ensure that Medicaid and Medicare remain accessible and well-funded. Meanwhile, political analysts see this move as part of Trump's broader strategy to energize his base ahead of his second term. Dr. Oz's appointment raises big questions about the future of healthcare in America. Will his approach lead to meaningful reform, or will it deepen existing divisions over healthcare policy? As we look ahead, Oz's tenure could become a defining chapter in Trump's presidency. It's a high-stakes role with the potential to impact millions of lives and reshape the debate over the role of government in healthcare. And that's a wrap for today's episode of the Daily Donald. What do you think about Dr. Oz heading Medicaid and Medicare? Will his leadership bring positive change, or do you have concerns about his track record? Let us know in the comments below. Don't forget to like, subscribe, and hit the notification bell so you never miss an update on Trump's most iconic moments. See you next time.